terms of seniors, they should come in and get their hearing checked at least once a year.
Absolutely. The reason for that is hearing loss has a lot of issues that kind of come up with it. So they've recently done studies in the last decade on hearing loss and a link to dementia, where hearing loss can actually put you at about a 24% or so greater risk of developing dementia or some type of cognitive impairment than if you do not have hearing loss. You're 3 times more likely to fall or be at a fall risk when you have a hearing loss than if you do not have one. And patients will often have issues where they feel socially isolated or fatigued with the hearing loss. So hearing loss creates a real health concern for those patients. There's even been a study recently where they went back and looked at, did this patient have hearing loss, did they not? And the patients with hearing loss, even a mild hearing loss, put them at a greater risk of ending up in the hospital that year than if they did not have hearing loss. Now, that doesn't mean that having hearing loss is a hospitalization, but you are at a greater risk of potentially ending up in a hospital as a factor of a hearing loss than when you have normal hearing.
You know, that was interesting. You talked about hearing loss and developing Alzheimer's. It's interesting that, you know, that has a correlation there, because as we see in our society, more and more individuals at such a young age are starting to develop Alzheimer's.
Absolutely. It's been a huge area of study within the field of audiology in the last decade. And we had to be cautious. I've seen some advertisements where hearing loss causes Alzheimer's or causes dementia. And that's still not the case. They haven't linked it to that degree, but it does seem to put you at a greater risk of developing it. Within the last 6 months, they've been really focused on study, well, really the last few years, but within the last 6 months, they've had some studies come out where hearing technologies, hearing aids, they've been working to find, do patients that use hearing aids, they found that it's reducing their listening effort, improving potentially memory, and helping with speech processing. And speech processing all takes place in the brain.
Right.
So they're hoping that the link of, if you start using hearing aids earlier, will that slow down or minimize your risk of developing dementia later? So that's why it's so important to do that early intervention, that early diagnosis of the hearing loss, so that if there is a hearing loss present, even if it's mild, that we can go ahead and intervene and start with hearing amplification early to hopefully minimize any potential risk of cognitive impairment later.
Okay. Now, how can our audience contact you?
Certainly. So the best way to get in touch with me is through my phone number.
All right.
504-738-4557.
All right.
I also have a website. It's www.accessiblehearingaids.com.
Okay.
So it's accessiblehearingaids.com.
All right. And well, it's up on the screen, and we'll have that phone number so people can call you. Before we sign off,
okay.
Does drugs, because, you know, there are a lot of seniors on different kinds of medication,
okay,
does that lead to hearing loss too, or what?
No. Can you classify drugs?
Well, I mean, in terms of prescription medication.
Okay.
Yeah, yeah, right. You're right.
I'm not a pharmacologist
or
pharmacist. However, yes, there are interactions of medications that can increase your risk of developing hearing loss.
Okay.
Some of them, as simple as aspirin, have been potentially linked to the tinnitus or the ringing of the ear that can possibly exacerbate that. But before you change any medications, please speak with your physicians and pharmacists. Ask them the question. Okay. Does this put me at risk, or are there any interactions of these medications that put me at risk for hearing loss?
Okay. All right. Oh, boy, getting old is fun.
It is.
Yes, right. It is.
Better than the alternative.
Yeah, that's right. Better than the alternative. Better to be seen than viewed. Well, Dr. Griffith, thank you for coming on, seeing your profile, and providing us with this needed information.